3 weeks ago, I urged our leaders to put those over 65 years of age at the front of the line for vaccinations alongside healthcare workers and first responders. Now, today I'm happy to report that the Department of Health and Human Services has now agreed to this strategy. So if you or your loved ones are 65 or over, you will now be able to get the vaccine if the leaders of your state comply with these recommendations. Now, ICUs across the country have been filling to capacity with patients suffering from severe COVID-related health complications. Thousands are dying each day. The vast majority of the victims are over the age of 65. So we can drastically reduce the number of people dying or being hospitalized by following this common sense principle of allocating vaccines primarily on the basis of age instead of occupation. Now, from the beginning of this pandemic, the CDC has consistently warned of the serious health complications and high mortality risk facing older Americans if they contract COVID-19. People over the age of 65 account for more than 80% of total deaths and more than half of total hospitalizations. So this is really great news today that the Department of Health and Human Services is now recommending to prioritize the limited number of vaccines for those over 65. This will save thousands of lives if properly implemented. Now, the explanation for the previous skewed distribution recommendations were that younger, healthy workers must be given the vaccine to keep them from spreading the virus. But that strategy was based on the myth that someone who's vaccinated can't spread the virus. While the approved vaccines have been scientifically established to prevent serious health complications and death if one is infected, it has not been scientifically established that the vaccines prevent transmission of the virus. And Dr. Fauci and other medical experts point out that even those who've received the vaccine may transmit it to others. Dr. Lena Wen confirmed recently when she said it's possible that someone could get the vaccine but could still be an asymptomatic carrier. She said they may not show symptoms, but they have the virus in their nasal passageway so that if they're speaking, breathing, sneezing, and so on, they can still transmit it to others. Now, the CDC guidelines that recommended prioritizing the vaccination of tens of millions of young and healthy essential workers will not slow the spread of the disease. Instead, it will likely worsen the spread by giving people who've been vaccinated this false impression that they can no longer transmit the virus to their friends or loved ones. This confused messaging is dangerously misleading the public about what these vaccines actually do. Unfortunately, people around the country are getting these vaccines mistakenly thinking that they won't be able to spread the disease, so then they go and visit their vulnerable relatives, putting them at risk. For example, here's a paramedic featured recently on the evening news in Hawaii.
I can't even see my mom. This vaccine is a light in this darkness of COVID for all of us. For us first responders, we can rebond with our families again and not fear that I'm going to make my own family sick while I try and take care of everyone else.
This is a deadly misunderstanding. Now, given these facts, and with the exception of frontline healthcare workers and first responders who are constantly exposed to the disease and who are working overtime to take care of others, what is the justification for providing the vaccine to people based on occupation rather than age? There is none. The data is unambiguous. The main variable that predicts hospitalizations and deaths from COVID-19 is age, not occupation. So simply by providing the vaccine to those who are over 65 years of age, regardless of their status in the workforce, we could lower COVID-related deaths by 81% and hospitalizations by 52%. If we provide this vaccine to people between 55 and 64 years of age, we could further reduce deaths by an additional 11% and hospitalizations by 17%. So there is a clear path to reducing the number of people dying and alleviating the stress on our hospitals. We must take immediate action to save the lives of seniors and make the vaccine available to them now. Failure to do so will result in tens of thousands of Americans suffering preventable illness and death.